Hi, my name is Jeff Bloomberg and I'm the Chief Operating Officer here at MGE. And this week's tip is part 1 of 2 on the subject of customer, or in your case, patient retention. And you could almost subtitle it with how most dentists ignore their patient base. So let's just jump right into this. Most dentists are terribly worried about how many new patients they're getting on an average month, right? They need more and more new patients. And I'm all for getting a regular, steady flow of new patients into a business. It's why MGE does the new patient workshop. It's the only thing I'll plug in this tip. But so it's an important thing. But what ends up happening in a lot of cases, and let's just use me as an example. Let's say I become a patient in your practice. You marketed to me, and your acquisition costs on getting me, unless I'm a referral, if you're doing some type of external marketing, are going to range between $250 to $400. And that includes, postcards, pay-per-click, etc. It's going to cost you that much to get me into your office, okay? So you've had me come in. All right, now I'm in the office, and you do whatever work that I need to have done, whether you do it all this year or you spread it over years, right? But you do whatever work I needed to get done, and then you schedule me for my next recall appointment. All right, so I go into the charts. You're going to see me again in 6 months. So 6 months go by, and I miss my appointment. So you're calling me, and maybe I got a postcard in the 5th month. And then the 7th month, the 8th month, maybe I've gotten a couple phone calls. Eventually, I stopped getting phone calls. And maybe after 2 years, you've even deactivated me. So that all that money you spent, you maybe made whatever you made back on whatever treatment I purchased at the time, but you didn't gain a long-term patient out of the process. But the amount of effort that was spent once I missed that recall, for a lot of dentists, was extraordinarily minimal. It's a few phone calls, whereas there was all this effort spent on getting me in the first place, all right? So think about that for a second. You spent $300-400 to get me in, and then how much did you spend, or how much effort did you spend to keep me in, all right? So this is what ends up happening. It goes into a black hole. And I'm going to give you a little bit of numbers here, and you can kind of see where you measure up to see if you're actually retaining people or you're actually losing people. Let me throw these out to you here real quick. So I'm going to give you some averages, and then you can use this as a little mathematical formula for your practice. But let's say the average practice gets 30 new patients a month, all right? Now, out of those 30 new patients, let's say they lose over the course of, a year immediately or a few years, they lose 40% of them, okay? So 30 new patients minus 40% is 18 new patients. They netted 18 long-term patients that month, all right? Now, 18 patients are going to need to come and see you at least twice a year for 2 recalls, right? All right, that's 36 recall visits that you created that month. So let's say the average hygienist sees 8 patients a day. Could be more, could be less, but let's say 8. 36 divided by 8 is 4.5. So in that month that you got 30 new patients, you should have retained at least 60%. You should have created 4.5 days of hygiene for that month. If you do that every month, you've created, 4.5 days a month is a day a week. You should have created 1 whole day of hygiene for your practice every week for the entire year. Okay? You've added a day a week, in other words. So you could multiply this by year. That's that day a week formula you may have heard before. So if you've been in practice for 10 years and started from scratch, you should have 10 days of hygiene. All right? And possibly even more, because that doesn't account for any new patients or soft tissue management program patients that might be seeing the hygienist. That's just recall patients. So that's an example. Now I'm going to give you a little mathematical formula because I'm going to give you a little exercise to do before you come back and watch part 2 of this video series, just to figure out, are you actually retaining people or are you losing people? Because I see a lot of people that are doing less hygiene this year than last year, right? Or they're staying the same. That means that they're actually losing patients from the practice. Well, here's the formula. I want you to take a look at how many new patients you got last year. All right? Now, once you get that number, I want you to subtract 40%. All right? So if you had 1,000 new patients last year, you'd subtract 40% would be 600. All right? So subtract 40%. That's how many you should have retained long-term, minimally. Now multiply that number by 2. That's how many recall visits you would expect these patients to do. And obviously some are on 3 and 4 month recalls, so it could be more. But for simplicity's sake, let's keep it at 2. So you multiply that number by 2. That gives you the number of recall visits you should have generated. Now divide that number by the number of days a hygienist or number of patients a hygienist can see in a day, of 8. All right? So we take number of long-term patients we added, we divide that number by 8. We now have how many days of hygiene we should have added last year. All right? So let's say these numbers come out, you figure out you should have added 100 days of hygiene last year. Well, if you work 50 weeks a year, you take 2 weeks off, you should have added 2 days of hygiene a week. Now, compare that to what you actually added last year. You can start to see, do you have a problem here or not? Okay? And then you could start to, it's sort of a self-evaluation to determine what should you be doing next. Now, my plan is, once you've done this, I'm going to come back at you next week and we're going to talk about how do you retain patients? What should you be doing? Why do most offices not retain patients? And I'll be covering that in the next tip. So, as you've probably noticed, as I've gone through this tip, there's been a subscribe button. You know, we do these tips every week. If you want to stay on top of any tips as they come out, just go ahead and click subscribe. Otherwise, if you have any questions about MGE, you can find us online at www.mgeonline.com or call us at 800-640-1140. So that's it for this week's tip. I'll see you back next week with the remainder of the tip. Thank you very much. We'll see you then.